Good afternoon, everybody. Welcome to our Quit HIC webinar series for the SAFER Initiative. My name is Rachel Cooper, and I'm our Senior Program Manager for all things related to opioids, mental health, etc. at the National Safety Council. We really look forward to having you join us today. This 30-minute webinar is designed to share important, timely information for managing return to the workplace, especially as pertains to managing employee stress and anxiety. This is an actionable webinar. We are looking forward to being able to turn some of these recommendations into action. Ideally, we want this to guide employers through the process of safely resuming our traditional work environments and operations, both now as we continue to navigate the pandemic and then in a post-quarantine world. Morgan, you can head to the next slide, please. A specific thank you to, of course, our SAFER sponsors, Avetta, ISM, McElhatton Foundation, and US Steel. All of our material is created by the National Safety Council in partnership with industry leaders such as those listed above, leading safety organizations, and public health experts. So to go through our agenda for the day, on the next slide, we're going to talk a little bit just about our return to work guidance, our framework, our playbooks. We're going to talk about the Quick HIC document that we have published about managing employee anxiety and stress. And then we will turn it over to Carl Heinlein from ACIG to talk a little bit about the specifics that they have done to navigate this particular complex issue. And then at the very end, we'll do another review of the SAFER resources. I want to just let you know that as we go through this, that you can put questions into the chat. We will do our best to answer them. And if we can't, we have our email addresses at the end of the slide, and you can also email safer@nsc.org at any time with further questions. All right. So a little bit of background here. So as the SAFER initiative got started, we took a look at these 6 cross-topic actions, these 6 things that really we needed some guidance on, right? Framework, playbooks, etc. Physical, medical, stress and emotional and mental health, employment, legal HR, varying communications, external factors. Obviously, this is pandemic has impacted us across the board, right? And there's a lot of different things to consider. Many of these topics impact one another, but here today we're going to talk about exactly the stress and emotional mental health component. So the next slide, Morgan, there's a document that I encourage you all to review in depth, and this is talking about the broadest possible picture here. We're looking at the stress, emotional, and mental health considerations, not only about returning to work, but understanding that the stress, emotional, and mental health considerations related to the COVID-19 pandemic are far-reaching and they are broad. And this is certainly something that we may see for months and years to come. In previous situations that aren't that dissimilar, for example, other natural disasters, we do know that we can trace increases in mental health diagnoses, we can trace increases in substance use and overdose back to some of the impacts of a natural disaster or something similar, i.e. in this case, the COVID-19 pandemic. We also know that increased economic vulnerability and unemployment can lead to increases in mental health issues and substance use and overdose as well. Clearly, this is something that we will be working with and dealing with for a long time to come, regardless of where you are in society at this point. So after we published that, we did, of course, again, a quick series of quick hit documents on the next slide, Morgan. And I encourage you all to review all of these. There's 9 different documents here, taking a look at everything from entrance screening to workplace hygiene and action plan template. The webinar on that was yesterday, and I encourage you at 1 p.m. Central to attend the rest of the webinars throughout the week. And then take a look at this, and you're gonna figure out what works for you in your workplace, but I encourage you to review all 9 of these documents and with your return to the workplace team as you navigate this. So specifically about managing employee stress and anxiety as we return to the workplace. So there are several different components here. There are 5 main topics that we recommend. 1, we want to encourage employers to be respectful. And when I say be respectful, what I'm talking about is that everyone processes difficult, new and stressful situations very differently. Some people may be worried constantly, and that may show up in terms of being really hypervigilant. Some people may really shut down and may not want to communicate about this. All of your employees are navigating this differently. And there's a need to balance that and how everybody's managing the situation, you know, of course, with the need to get the job done. Primarily, open, respectful communication will go a long way to finding solutions that really balance the needs of individual employees with the needs of the business. So leadership, supervisors, human resources, all of the trainings that you already have in your back pocket, reminders about respectful communication and understanding, helping supervisors understand their role, understanding how to access support, providing that support for employees, proactively so that they don't have to seek it out is really important. And then of course, reminding employees that it's okay to feel anxious. It's okay to feel fearful. It's a very normal reaction. Making sure that, they understand that you as an organization, as an employer, will work towards alleviating their concerns and fears as best that you can. We also talk a lot about being transparent. One of the things that can be really hard for people is when they don't understand what's going on or why it is happening. So talking with your workforce, explaining what decisions are being made about return to the workplace, or why they aren't being made, giving clear timelines, really communicating that this is an uncertain situation for everybody, but really promoting that level of trust and communication can help people understand that, hey, we're all doing the best that we can. And they also encourage people to ask questions and say, okay, I don't understand what this is. How do I learn more? Again, when people are thinking about, okay, returning to the workplace, they may be concerned about what if I'm exposed to the virus and I bring it home. They may be concerned about the commute. They may be concerned about many different things. So recognizing that, acknowledging it, and taking those steps to be really transparent, providing confidential, support, all of those different things are going to be really important as we return to the workplace. And this goes for prior to return to the workplace. So for example, if you're working virtually now, maybe you have, team Zoom meetings such as the one we are on right now. As you return to, it's going to be important to get that feedback. How are we doing? What are the scary things that are not easy to handle right now? What does that look like? So making sure that this is both something that can be done virtually and then as you return to the workplace. Of course, educating your employees is really important. It's sometimes hard for us to recognize signs of mental health distress in ourselves. Sometimes we may think that we are handling things just fine, but maybe other people are noticing that, hey, you're not, maybe you missed a couple deadlines, maybe you just aren't as present, maybe you've been signing off early, just trying to take care of yourself. All of that is a sign that maybe you need an extra level of support. So educating yourself, what am I seeing in myself? What am I seeing in my colleagues? What do I do when I see something that is worrying me, and really providing all of those resources up front, making sure that on your company intranet you have some support resources about not only reaching out, recognizing signs and symptoms, but also respected, trusted resources on the pandemic, etc., just to make sure that everything can be easily accessible for people when they have questions. This also can look like lists of local and national resources, not only on, the disease prevention component for COVID, but also, the National Suicide Hotline, varying other resources for mental health. The National Alliance for Mental Illness has some great resources. There's a crisis text line. All of this will be shown later in the presentation and is in the documents that I mentioned earlier. All of those are good things to have on hand for your employees. And then, of course, preparing your supervisors. Supervisors are often the door to getting help at a workplace, right? Sometimes employees go straight to HR or the EAP. Oftentimes they end up going to their supervisors. They may be the ones that they have the closest relationship with. So what does this look like, right? Obviously education on signs and symptoms, understanding, helping supervisors understand the options that are available to employees via benefits packages, via the EAP. All of these are important. And then sometimes the interpersonal skills, active listening, respectful communication. Supervisors are feeling stress as well. They are not immune to this, so they also need support. And then making a recommendation that maybe, hey, we adjust the expectations for the first few weeks back. Avoid overloading employees and kind of make sure that you're spacing out deadlines, recognizing the difference between urgent and important tasks to really help everybody reacclimate to being in the workplace. And then, of course, last but not least, all of this must be accompanied by aligned policies and procedures. Maybe this looks like continuing to support remote work. There might be something about incorporating mental health leave into your sick leave policies, etc. Flexible time, this might look different if childcare isn't reopened, for example. What does that look like in a workplace? How do we make sure that employees have the time to take to do all of these different things that they really, really need to focus on, and then helping employees truly prioritize self-care and wellness during the week when they're in the workplace. What does this look like? It might look different than it used to. Maybe the break room isn't a place where people can be because of physical distancing rules. How are we going to navigate that? How do we communicate that to our employees? And really making sure that people are doing the things that they need to do to take care of themselves, because healthy employees are safe employees and they are good employees. So with that being said, I'm going to turn it over now to Carl Heinlein from ACIG. And Carl, I would love it if you would tell us a little bit about yourself and your organization, and then we can go through your slides and you can talk about how ACIG has addressed this in the workplace.
Thank you, Rachel. Thank you, everyone, today. Hopefully you can hear me okay. I'll do a sound check real quick. Okay, great. Well, thank you, Rachel. Thank you, NSC, the Safer Coalition, and all the folks that are on the webinar today. This is such a critical topic. In fact, while I was researching this, in fact, if you read your Safety and Health magazine for June 2020 on page 22, there is an article that's titled "Managers' Attitudes Toward Worker Well-Being Can Lead to a Safe and Healthy Behaviors." It's a study, and I'll make sure we share that with the team to add on to this. But, you know, the timing of this is good. So again, my name is Carl Heinlein. I work for a captive insurance company called American Contractors Insurance Group. We're made up of 40 contractors that we do workers' comp, general liability, and auto liability for. The thing that's interesting is the contractors own us. So when it comes to safety and health, they share the risk with every other contractor. So we feel we're very nimble and we adjust pretty quick. And, you know, and during the COVID situation, in many cases, all of our contractors in one way or another continued to work. So one thing that I'm always proud to say about the construction industry is we're problem solvers. And we also feel that America progresses through construction. And so we had to develop plans on the run, on the move from day one. And very proud to say that we've done a pretty good job on it. We're always learning. But with these contractors I work with, we do everything from street and road, civil, general building, and industrial. So when you take a look at all those different owners that we work for, that creates a lot of different issues. A hospital is different than building a bridge or a street and road scenario where there's exposures and there's different exposures for, you know, street and road, where in a hospital you may have clients that are close to you. What we've done within ACIG over the years is we perform about 4% of the construction activities in the country, because our general contractors, so many subcontractors and vendors that work for them. Again, this builds for our exposures and our experiences across the country, not only the variety of businesses that we build for, but also the amount of subcontractors that we work for from shore to shore and coast to coast. So some of the things that we've learned along the way, and if we can move to the next slide here, a couple things I want to just give a high-level overview on is pivoting to meet the mental health impacts of COVID. Again, we were working from day one when this started to hit, and it started out in Washington, and we have a number of large projects in the state of Washington. So, you know, we work collaboratively, and a couple keys of what we've learned is teamwork, collaboration, timing, the understanding of responsible parties, and then one thing we did as well is we benchmark as an organization. We benchmark internally with our 40 contractors, but we work with the National Safety Council, our trade unions, our trade associations to find out the best of the best. And again, you know, in the construction industry, we have a number of great resources out there, the Associated General Contractors of America, CPWR, the laborers, and we work with the National Safety Council to really make sure we weren't overlooking things, because as we all went through this, we had to change abruptly. In many cases, some industries, they had to shut down completely. As we continue to move, one of the things that we really took a look at was trying to pivot was, as these plans were going on, we had to stop and say, what is going on with our employees? Their spouses, their families, they may not be working, they may be sick, they may be living in multi-generational houses with elderly parents with young children, and what would the exposure do with them. We were still, particularly in March, trying to figure out who, what, where COVID was coming from, how we protected ourselves. And really from the beginning, we have been really pushing the social distancing, the sanitizing, and wearing of masks or face covering. That has been consistent the whole way through. And as we've gone through that process, one of the things that we really learned was we didn't do the greatest job of communicating. We did a good job in the office, but to get out to the folks in the field, and not only the field, in some cases, the job might have been the safest place for some of our employees, depending on where they lived and some of the, the exposures they had in their home or when they were traveling. So we really emphasized to take the message home. So a couple of things that our contractors did was they really upped the use of social media. They upped the use of podcasts, toolbox talks, training. And because the construction industry is made up of wonderful folks from all different areas of the world and different languages and different education levels, we had to make sure that the education was on point. So the use of color coding and graphs and messages in their native language was key to making sure this message resonated back not only to them, but to take the message home. And we were in March where kids were still in school and all of a sudden they were pulled out. Now we've got kids that were in college that were pulled out. We have spouses, family members that their jobs were shut down. So now you have houses that are now many people in there, and the stress level went up. So in a couple of our contractors, we watched our employee assistance program calls and contacts go up by 500%. So what were we doing to make sure that our employees understood it's okay? Talk to us, use that resource. So we did this is where the collaboration comes in. We did a lot of our contractors did a great job of building specific crisis teams or COVID teams of HR, safety, operations, management, folks from the field to make sure that that message going home was clear and concise. The message on the job was clear and concise, but there was also a safe place where if people had questions or issues or concerns that they could come to us. And we learned along the way. We did some things great at the beginning. We also learned that we could do better. In this situation, a lot of people did not want to lose their job. So they were very hesitant to say maybe they weren't feeling good or they had someone at their house wasn't feeling good. So we had to work with them and say that this was not going to be a scenario where you were going to lose a job. We'd rather you be home for a couple of days, 14 days, than coming back and exposing someone. So a lot of moving parts on this. And again, the collaboration was extremely impressive. What we did as an organization too, starting in March, we did town hall meetings and we did them basically regionally. We did 4 a week just to have open conversations about what is happening. So what was happening in the state of Pennsylvania was different than what was happening in the state of Washington. So we were really trying to learn from each other and gather best practices. So those calls happened on a weekly basis for the first, probably till the middle of April. Then we kind of backed off a little bit and we did it every other week, and we're still doing them every other week. And instead of having 4 town hall calls, we're having 2. We've combined some meetings, and really the agenda is set by the contractors. So we have 2 this week, and some of the things we're talking about specifically is masks versus face shields, masks and face coverings in the hot conditions. What is a greater hazard? Some other things we're talking about is people are traveling. How do you travel people from job to job? Do you want them to do that? Do you not? So we're digging into best practices off of that. The other thing is, what are we doing if people are traveling to states that have high upticks in COVID? Are we putting them in quarantine when they come back to the corporate office? So lots of conversation going on. And the thing is anyone tells you they have the solutions, all of them, I would be a little hesitant to agree with that, because we're learning something every day. And what we're encouraging our contractors, there's no such thing as a silly question right now. Please share it with us. We'll dig a little bit more. We had a conversation with the university this morning about, some of the university folks are coming back onto the campus, getting ready potentially for students to come back and they see contractors walking over there and they're asking questions. Should they have a mask? Shouldn't they have a mask? So, we've seen complaints in our industry across the country go through the roof of people saying, hey, they're not wearing a mask. Well, there may be extenuating circumstances behind that. So the construction industry is trying to do the best we can to not only do the right thing, but to show that we're doing the right thing and continue to do so. I'm very happy to say that, I checked our statistics again. We have not had any worker fatalities, worker deaths on any of our projects related to COVID. We've had some illnesses and we've quarantined some people, and we've done a very good job of that. We've had some people that have, just said, hey, I'm not coming to work because I'm parents at exposure. So we're working with that. Again, it goes back to collaboration, and we're really doing a lot of lessons learned on that. The collaboration between HR, safety, claims, operation, and management to make sure we're not overlooking things. Our job as organizations is to make sure that our employees are feeling that they're coming to a safe and healthy environment, and we're going out of our way to do it. I am proud to say we've watched some of our contractors create, invent, develop some of the finest wash stations, plastic partitions, pathways, scheduling things. So they're using every bit of the hierarchy of control that will move things forward. And what we're seeing too is probably some of these practices that we've learned will probably stay with us for the long haul. And it's probably for the good reason. So we're going to continue to learn. We try to have a meeting with our occupational medical advisor once a month. We have one scheduled for 2 weeks, and we're going to find out if we're missing anything. Again, this is a moving target. We're always trying to learn. We're trying to share some things. One thing that I think that is also very important on the stress and mental health is every meeting we start with, we check in with everybody. How's everyone doing? Do you need anything? Call us offline, text us, talk to us. We're here. We want to make sure we're answering any questions you may have, because really everyone on this call, everyone in your industry, we are getting flooded with information, some of it being very accurate, some being kind of accurate, and some not even on the mark. So what we don't want to do is flood people with information. We want to make sure it's crisp and clear. So some of the things that we've done from the management and employee experiences is we really, in clear communication, consistent communication, ongoing communication. Those are very, very important keys to make sure the employees are feeling engaged in the process, also feeling that they have an opportunity to talk to someone in a comfortable and open scenario. I mean, let's think, we just came out of 4th of July holiday. We're seeing some upticks in some areas where people party together. We're getting ready for some stress for folks to try to go back to school and college, and they don't know what's going to happen in the fall. So, we still have a ways to go to get past this COVID. We don't know what the time frame is, but what we can do as organizations is go and make sure that we're making the employees, whatever level they are within the organization, C-suite, to the folks that are out there in the field and on the dozers and using the pickaxe, that we want to make sure that they understand that there's a place that they can ask questions, they feel comfortable, and to continually share with them good measured information. I want to move to the next slide here as we go for the impacts in the coming months. Some of the experiences from the employees and the leadership is one thing I don't want to overlook, is we've had them tell their stories as well. They've told what they're doing in our toolbox talks and our podcasts to share what they are from their peer-to-peer conversations about what they're doing at home, how they're taking care of cleaning their truck coming to and from work, or what they're doing when they prepare to come onto the project. So that peer-to-peer conversation has been wonderful. And again, we're sharing that on Toolbox Talks, Zoom meetings, as well as podcasts. So great use of social media. But again, as we move into school, we're getting a lot of questions from our folks, and typically we're working through this with them. There's a lot of stress that's starting to happen right now with school coming up, and people not knowing what to do with their kids, maybe in elementary school, day school, high school, or college, what they're going to do, or even trade school, what they're going to do about that. So, you know, again, I would encourage everyone on here, share your best practices. SAFER is a wonderful opportunity, organization-wise, with the National Safety Council with the lead. Keep sharing your information so we can all learn from it. Another thing that we've really got to take a look at, and I know we're getting close to our time, but I don't want to overlook it. We've had a number of folks that have had issues that we want to try to help them through, may it be alcohol, drugs, opioids, stress, anxiety, all this way through there. We have to make sure that they understand that there's a safe spot with that. And in these times, there's a multitude of ways to do it. We hopefully can get everyone to make sure that they know there's a safe spot. And it may be a colleague, a pal, a friend, a family member, but we've got to continue to impress upon everyone out there that, you know, this is a safe haven, a safe harbor. May it be your employee assistance program, may it be a trusted supervisor or a peer, may it be through their labor union. We've got to continue to push that. Another thing that we're seeing a real good uptick on is the use of telemedicine. They don't have to call me, but they have an opportunity to use their telemedicine to reach out to a doctor and say, this is what I'm feeling, I need some help. So again, we're not out of this. We're not going to give up. We're going to continue to ask questions. We're going to continue to work as a team, from leadership to the folks in the field that are building these wonderful projects around the country. And as you noticed, work hasn't stopped. So we have to continue to keep pace with work, with the issues we're dealing with COVID, and we have to provide them with tools and resources for these folks that build America, that you know, there's a place for them to feel a safe harbor. And again, you know, these are some overviews. My information is posted on there. You could call me, email me, text me at any time. I'd be glad to share any of the resources that we have. We've loaded a lot of them up into the SAFER website. And as you can tell, Rachel and her team and the National Safety Council have done a wonderful job of developing some really easy to use tools to share with your folks, not only on the job, but hopefully they're taking them home as well. So with that said, I'm going to open it up for Rachel to kind of close this session out, and we'll be glad to answer any questions.
Thank you so much, Carl. We really appreciate you sharing your experiences. I think a couple main takeaways there are that information sharing as a general rule can really help reduce anxiety. What are the physical components of returning to the workplace? What are the mental components? Lots of good sharing, lots of checking in, lots of really building a solid culture of safety and trust. To answer a question that's been frequently popping up, yes, the slides will be sent out, so no need to scribble things down. We will be sending these out. And of course, again, our email contact is on the last slide coming up here in a second. Morgan, if you want to go to the next slide, I just want to review real quick. For those of you who aren't particularly familiar with the SAFER initiative, nsc.org/SAFER is where you can find all of this information and more. In particular, the next slide, Morgan, we do have a new, very excellent tool called, it's an organizational vulnerability assessment, and you can start the assessment. It will take a bit of time to complete, 30 to 45 minutes. However, it really helps you assess your organization and where you're at in terms of risk. And then it really helps you, gives you recommended actions to look at those specific risks and to really assist you in creating a plan moving forward. So this is a really important tool. It's a very exciting thing. It's free. Go visit nsc.org/SAFER to visit it. And then the next slide, Morgan, just a quick review of the other things up there. We have a lot up there. We have resources for members. We have the general framework, varying ways to take action, employee surveys, review of federal guidelines, etc. Feel free to click around. And then again, of course, you can always reach out to safer@nsc.org with specific questions. And then one just quick reminder, back by popular demand, on the next slide, we do have our SAFER Return webinar, and that's July 15th at 11 a.m. Central Time. And Catherine and Anthony will walk through the SAFER framework in its entirety and about how to create a plan for safe return to full operations. So feel free to register for that. Information is down there at the bottom of the screen. And it is close to the half-hour mark, which is questions, at which point we are wrapping this up. So the last slide, I just want to, reiterate that we really appreciate having you joining us today. Thank you again to our sponsors. These are our email addresses. They will be in the slides when they are sent out. For those of you who have questions, we can feel free to reach out to either of us or also safer@nsc.org, and we can make sure that we get those questions answered individually. Thank you guys very much for your time today, and have a safe rest of your week.